National recommended standards of care discourage the use of tasers and other weapons against people in psychiatric crisis, especially in medical or therapeutic settings. In a position statement from the American Psychiatric Association, it said, the use of weapons to manage behavioral discontrol conflicts with the therapeutic mission of healthcare institutions and should therefore be limited to use only when an imminent risk of life-threatening injury exists. However, what happens when the psychiatric crisis is being treated at the Marion County Jail? On September 10th, Ocala Police Department responded to a Wawa convenience store on Pine Avenue. Employees report that a woman, later identified as 29-year-old Maniesa Fletcher, is walking through the store, eating and drinking products without paying, and shouting threats at cashiers. Fletcher is arrested and booked into Marion County Jail on misdemeanor charges. Fletcher's medical records reveal complex medical history. She has a deep brain stimulator and a cardiac pacemaker, as well as multiple mental health disorders and epilepsy. On September 12th, just 2 days after her arrest, jail records reflect Fletcher alerting guards saying, "I'm not all right. I want to hurt myself." On September 18th, jail records indicate Fletcher attempts to pull out her own eye. During a strip search, staff discover a self-inflicted chest wound, apparently caused using a toothbrush in an attempt to cut her brain out. Despite these actions, staff do not initiate a Baker Act. Instead, a nurse submits an expedited request for Fletcher to see a medical provider. Fletcher remains in the infirmary, but the following day, her situation escalates. Jail medical records for this time period do not reflect Fletcher taking medications to treat psychotic issues or her epilepsy, although they are prescribed during her prior incarceration for similar behavior. This footage is from inside the jail infirmary on September 19, 2024, and it shows one of the nurses and jail guards making rounds to take inmate vitals. Fletcher could be seen speaking to the nurse and the female officer, but records do not reflect what she said to them. She places her finger inside the monitor as the second officer holds open the cell door. After it opens, the first female officer is seen with her taser drawn, aimed directly at Fletcher. Fletcher appears visibly startled and flinches backwards when she sees the taser. She begins to cry, and the female officer puts her hand on Fletcher's shoulder and pushes her back into the cell. The officer puts the taser back in her holster. The nurse begins to check her vitals again. Fletcher is seen holding her chest and speaking to the nurse. She looks down at the taser and grabs it and retreats back into her cell. According to jail records, the two officers struggled to regain control. The infirmary door closed, locking them in the cell with Fletcher. Backup is called, and a third responding officer enters the cell and deploys a taser into Fletcher's back to subdue her. It is reported that Fletcher did not discharge the stolen taser on any of the officers. Fletcher was placed in handcuffs, restrained, and returned to her cell. The next day, on September 20th, Fletcher was involved in another incident where she jumped from the sink in her cell and hit her head on the wall. She's also pepper sprayed twice that day for noncompliance with a strip search and cell inspection. 2 days after the expedited request was put in for Fletcher to be seen by a healthcare provider for the self-inflicted wounds, a nurse practitioner visits her in the infirmary. The medical encounter indicates that the provider was unable to assess her and she refused care. Over the next month following the incident, medical records show that Fletcher would be visited daily by a mental health counselor, the majority of the time refusing to speak with them. Despite having multiple mental health disorders, a psychiatric evaluation of Fletcher would not be completed at the jail until October 30th. The original misdemeanor charge for stealing $13.95 worth of goods from Wawa was compounded when the state attorney filed 2 felony charges after the September 19th taser incident. This escalation, driven by Fletcher's mental health struggles, kept her in Marion County Jail far longer than her initial arrest warranted. Records show that Fletcher continued to struggle in the infirmary with mental health issues and seizures. On January 13, 2025, medical records show that she had a seizure. The following day, she is pepper sprayed for noncompliance. She would again be pepper sprayed on the 15th for not responding to verbal commands. 2 months later, Fletcher is found unresponsive, face down with a blanket over her in the infirmary. She was pronounced dead on March 14th. Sheriff Billy Woods declined to interview to talk about the challenges of incarcerating the mentally ill.